Protect mental health, be the self-starter. Series 4. COVID-19, Beating the Path to Recovery in Mental Health. Episode 3, Burnout. Since the start of school term in September, the rising number of student suicides raised the alarm on the mental health of our school children. A study has shown that 1/4 of the school children suffer from mental illness and pointed out that teachers are under immense pressure and their mental health deserves concern. After the return to normalcy, both the workplace and schools are busy catching up with the time, business, or achievements lost due to the pandemic. This episode attempts to address the phenomenon of burnout on the path of recovery. Burnout. In 2019, burnout is officially included in the 11th revision of the International Classification of Diseases ICD-11 as an occupational phenomenon, but not classified as a medical condition. It is defined as a syndrome resulting from chronic workplace stress that has not been successfully managed. It is characterized by 3 dimensions: feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. In terms of energy depletion, one may feel that their mental energy is depleted, and they have nothing left to offer. For instance, by the time they have finished their work for the day, the burnt-out teacher feels that they feel powerless and have nothing more to offer to their students. In addition, there is an increased psychological distance from work, a reluctance to put in any more effort, and a cynical attitude towards the work. They may unconsciously treat their service targets such as students or patients as objects. At the cognitive level, cognitive impairment may occur. For example, one may need to read the relevant information repeatedly to understand it. Emotionally speaking, they may find it difficult to manage their negative emotions and lose their temper easily. The overall professional efficacy and performance drops. Study burnout. Every day, students follow the routine to complete schoolwork and assessments, either alone or in groups. Like adults in the workplace, they need to meet the expected standards, or else they need to repeat or change schools. Be it university students, secondary students, primary children, or even kindergarten kids, if they are stressed by studies for a long time and fail to find ways to cope with the stress, they will suffer from constant mental and physical exhaustion, reduced motivation for what they used to enjoy, demotivated for study. Gradually withdrawn behaviors such as school refusal, staying away from their classmates, and marked decrease in academic performance become prominent. In the past 3 years or so, we all have been battling with the life-threatening COVID-19 pandemic. It is no doubt a prolonged traumatic experience. Now, during recovery, shouldn't we be more concerned with physical and mental health recovery than with grades? Ironically, while the whole city is worried about the rising number of student suicides, there is still wide coverage on reporting in big headlines the overall unsatisfactory assessment results in Territory-Wide System Assessment, TSA, first held after the outbreak of pandemic. I cannot help feeling the emotional blow on students, teachers, and parents who are busy in finding footing on the path of recovery to normalcy. I wonder if there is a rising trend of study burnout at an early age. Should we conduct a territory-wide survey on study burnout across all key stages of learning? Although factors contributing to student suicides are complex, we should not overlook the fact that learning environment can induce burnout or psychiatric disorders. COVID-19 recovery, pandemic fatigue. In August 2022, the World Health Organization, WHO, organized a symposium to discuss long COVID on children and adolescents who recovered from infection. Fatigue or tiredness is the most prevalent and common condition. Upon return to work or study, have we paid attention to the health conditions of ourselves or others such as colleagues or students who were COVID infected before? Are we still suffering from long COVID? When students feel tired in study, can we detect any abnormalities? Conclusion. Stress can motivate us to perform better, but chronic stress may trigger mood disorders if not managed well. This episode addresses the issue of burnout at work or in study and pandemic fatigue. Let's reflect if we are in the state of burnout that can pose a threat to our mental health. Author, Dr. S.B. Chan, Doctor of Psychotherapy and Counselling, the University of Edinburgh, UK. Master of Science in Mental Health, the Chinese University of Hong Kong. Master of Science in Psychiatry, Cardiff University, UK.